Ayush.
Okay.
Are all of us here?
No, sir, not yet.
Okay. So we have the organizers only, right? Or do we have some of the contestants also?
So we have two participants who have already joined in. This is sorry, sir.
Do we have any of the participants with us already?
Yes.
So two participants are there. Should I like remove them?
No, actually, I have a very small announcement to make. I mean, it would be told to all of them again. So there's a change from yesterday's plan, a bit of a change to make it a little bit more interesting and, So we will have 10 questions for all the teams, but we will have the first 6 rounds as compulsory rounds where they have to answer the questions directed to them. And 11th to 13th round will again be a compulsory rounds in which they have to answer the questions directed to them. Now the rounds 7, 8, 9 and 10 will be clubbed together. They have to answer any one question out of those 4, that too from the round which they choose at the beginning of the quiz. So when we begin the quiz, we will ask them, which round do you want to answer, 7, 8, 9 or 10? Now, whichever group chooses whichever number, we have that question fixed. Okay, this is round 7, team A. So, if team A chooses round 7, they get to answer round 7 question. Similarly, if team B chooses round 8, so they get round 8 question. So like that. Okay. So they wouldn't know which question is there in round 7, 8, 9 or 10. They would have to choose right away from the beginning of the quiz which round they want to go for out of 7, 8, 9 and 10. And then we will ask them that particular question which is allotted for them in that particular round. Okay. So there would be 10 questions for each of them. So the time problem won't be there. That is how I have figured out how we can include all the rounds yet not,
Okay.
shoot the time.
And then please do note down which round is chosen by which participant.
That I will also note down. I have kept a piece of paper and pen with me. If one of you want, the scorekeeper also may keep track of that because he has to enter the marks in the mark sheet. The mark sheet will have round 1, 2, 3, 4, 5, 6. Then the mark sheet will have 7/8/9/10. So there would be 1 mark for 7, 8, 9, 10. And then again, it would be 11, 12, and 13. So there would be 10 marks for, 10 columns for each group.
Yeah.
So I would ask you to explain these rules.
Yeah, you didn't understand.
Yeah, we understand. I would ask you to explain these rules to the participants when they join.
Yes, I will.
So they will choose.
Let them in, I think. Are they free?
The 2 participants are still remaining, or 3 of them.
Why am I not being able to see them? I want to see them also.
But, please switch on the videos. The participants are requested to switch on the videos, please.
Sir, the mark sheet I will share once. You can see it.
Hello.
We can admit Vaibhav. Vaibhav is one participant, right? Is this Vaibhav Agarwal from AIMS?
Sorry, sir.
Is it Vaibhav Agarwal from AIMS? I know one resident. No, but he's a PG resident. He won't be eligible for this quiz.
Oh,
From Aditya Medical College. Sir.
Oh, achha.
the mark sheet is okay.
1, 2, 0, 5, 6. Yes, absolutely fine.
Okay.
The other two participants, please give them a reminder. Ayush.
I'll start sharing my screen.
Two participants haven't joined in yet. We are waiting for them.
So we will tell them which participant have got which team.
Okay.
All of them joins.
Am I audible?
Yes, sir.
Yes, sir.
This I'm not using any video, so I don't. And is my screen visible now?
Yes. Yes, sir.
Ayush, you have the numbers. Please call them up once.
Can you give the name? Who is that?
So currently, yeah, photo.
Do we have all of them? Vaibhav, I can see.
Nirban and P. Sriram.
Ask the participants to switch on their videos. I mean, their webcams.
The Nirban here.
Iman, sir, can you please switch on the video?
It's not.
Participants are requested to keep their videos on for the session of the quiz.
Where are they?
Hello. Hello.
Yes.
Ayush, can you check? I guess everyone have joined.
Let me see. Wait a minute. Young participants.
Four. Only four participants.
Four. There are only four.
Yeah.
Only one just asked me if you should. He's saying there's something wrong with his internet connection. Calling.
have 5.
Is there anyone?
Who's left?
I have 5 only. 1, 2, 3, 4, 5.
We'll have 5 candidates.
We have 6.
No, we
Who
have
is
6.
she?
Where is
So
the
Indri Banerjee. Yes.
But she's in the waiting. There was a notification that she's in the waiting room and she was asking to be admitted.
No, sir. Sir, that is Dr. Shoyamji. He is one of the organizers.
Yeah,
Okay.
she's in the organizing team.
Yeah, he's joining right now. So fine.
Is everyone there?
One is missing. I just called him. He said he's joining. Don't know what happened.
Okay, who's Ayush? By which name is he joining?
What?
There was someone.
Haridwaj.
Oh,
Is Bharadwaj the 6th candidate?
Might be. It is. Hello.
hello.
He might
No.
be joining. Maybe he might be joining from someone else.
Bharadwaj Ram.
Hello, Ayush. I think you should start with Sir's introduction and he can join in the meantime.
Yeah, I'll do it. So, welcome everyone to the Mediquiz finale presented by SAMSACON. Here, first of all, congratulations to all of you to make it out of the prelims and qualify for the finals. So, as discussed, we have our quiz master, Dr. Dhritiman Maitra. He is more than just a breast and endocrine surgeon. He is man of many talents. After passing MBBS and MS from Medical College, Kolkata, with several accolades, he went on to earn the degree of MCH in breast and endocrine surgery from AIMS, Delhi, with a gold medal, a DNB, an FACS, as well as an FIAGS fellowship. He is the winner of an international scholarship of an Asian Association of Endocrine Surgeons, among the several other research fellowships, a traveling fellow of the Asian Society of Mastology at Wythenshawe Hospital, Manchester, UK. He has been associated with Ministry of Health and Family Welfare and National Institute of Cancer Prevention for breast cancer screening activities. Currently working as assistant professor and in charge breast and endocrine surgery services and clinic, Department of Surgery in his alma mater, Medical College, Kolkata. We are really privileged to have Dr. Maitra with us as our quiz master for the Clinical Mediquiz. Now, I would like Anjana Ashok to provide the candidates with their group numbers, which we will be calling for the questions.
Good evening, everyone. Team A has been assigned to Anirban Dev. Team B has been assigned to Mahima Adiveta. Team C has been assigned to Mimansa Zindal. Team D has been assigned to Weber Agarwal. Team E has been assigned to Somodipta Satpathy. And Team F have been assigned to P. Sriram. Please remember the team names. We will call out by this in the
In the success,
competition.
we will call you out by the team names. Now, I would like Sir to please explain the rules of the quiz.
So it's a 10-round quiz, but actually there will be 13 questions for each of you, of which you can choose 10 questions and answer them. So the first 6 rounds will be compulsory. We have team A, first round question, team B, first round question, and then again team like that, Team A has all questions from rounds 1 to 6, team B has questions from rounds 1 to 6, like that. And then again rounds 11 to 13 will be compulsory, in which all the teams have to answer all the questions which are thrown at them in that particular round. Since this is a virtual platform and we run the risk of some kind of cheating would be a harsh word. I mean, some kind of people resorting to net and all. So we won't have marks for past questions. If one candidate passes one question, other candidates may choose to answer. I mean, they may volunteer to answer if they know the answer. Otherwise, I mean, but irrespective of that, they won't get any mark for that. I mean, even if they get it correct. So that is about rounds 1 to 6 and rounds 11 to 13. So 9 rounds. And of rounds 7, 8, 9, and 10, you have to choose one round at the beginning of the quiz. The question from which round you want to answer, that you have to tell at the beginning of the quiz without knowing what question is allotted to you in each of those rounds. It might be so that you choose round 7, but the easy question for team A lies in round 9. So that's, we have introduced an angle of uncertainty by allowing you to choose your own fate by telling us which round question you want to answer out of rounds 7, 8, 9, and 10. And this you will have to tell at the beginning of the quiz. For each correct answer, you will get plus 10. There is no negative marking. So the maximum you can score is 100. And best of luck to all of you. And now we shall start. Do the organizers want to say anything more? Or do we start straight away?
No, sir, we can start.
So you can start. All the best to the participants.
Team A, tell us which round would you like to take? 7 out of 7, 8, 9, and 10. You tell me a number and you will be asked a question in that particular round, and in the other rounds out of 8, 9, 10, 7, whichever you don't choose, you won't be asked any question in that round. So team A,
So, like I have to choose only one round out of the all 4.
Yes, you have to choose only one round out of 7, 8, 9, 10. Rounds 1 to 6 and 11 to 13 are common to all. You have to answer questions which are allotted in those rounds. I mean, all the teams have to answer that. And out of 7, 8, 9, and 10, you can choose one number and you will be asked a question in that round. In the other 3 rounds, you won't be asked a question.
Sir, I'll choose round 8.
Team B?
Sir, round 7.
Scorer, please note. Team C?
Sir, round 8.
Team D?
Sir, round 9.
Team E?
Round 7.
Nobody chooses round 10. Sriram? P. Sriram?
Sir, round 10.
Okay. So, we start the quiz. Best of luck to all of you. Direct questions, plus 10. Past questions, you can answer, no marks. But answer only if you know. Don't waste time. Okay. So, first question. Round 1, Team A. Anirban.
Sir, will this question be carrying any time?
I will read out the question and you have to start answering within 30 seconds of me finishing the question. And if you can't, I mean, you can take whatever time you want to answer, but you have to start within 30 seconds of finishing the question. So you can see
Okay,
two
sir.
photographs of
I'll be keeping the time. So I will say time up once 30 seconds are over.
Yes. So team A, you can see the pictures of 2 personalities. They are related to each other. That's a hint for you. Now you have to suggest some medications for him. And from all the media reports we have, the disease she suffered the disease she suffered from. My question is, could her treatment be responsible for this condition? That is for her hair loss. Your time starts now.
Yes, sir. For the first person, I would like to suggest topical minoxidil first, and if it does not respond, then we can give a trial of 5-alpha reductase inhibitors like 5-alpha, like finasteride. And for the second person, it is because of cancer chemotherapy that her hair loss occurred. So yes, it's the treatment is responsible for her hair loss.
Anyone wants to modify? Anirban, I'll give you a 5 for the first part because that's correct. That's completely correct. For the second part, all the media reports were that she is suffering from DCIS, stage 0, DCIS. And in DCIS, you don't use chemotherapy. In DCIS, and she underwent mastectomy, so she probably wouldn't require radiotherapy also. And hair loss could be explained by only by chemotherapy in patients who receive it. Since she was not a candidate of chemotherapy, her treatment has not caused it. It was her choice to go bald as a, I don't know, mark of what, but I mean, her treatment didn't cause it. So I think I'll give you a 5 out of 10 for this question. Now moving on to team B. Scorekeepers, I hope you're keeping the scores.
Yes, sir.
Okay. Team B. Identify this personality and say how she is related to the term automatism. Mahima.
Yes, sir. This personality is Marilyn Monroe, and she's related to automatism because of one of her movies in which she, her personality did.
You have to be more specific.
Sir, I'm not sure which movie though.
You identified the personality correctly, but the second part was like nowhere near. She died of barbiturate poisoning. And automatism is something where you forget that you have taken your medicines and you take a second dose over and above the first dose, and then there is accidental overdosing and poisoning. So that is what had led to her death. So that is how she is related to automatism. So I think I'll give her a 5 because she identified the personality correctly. Moving on to team C, it's Minakshi, no.
Sir, it's Mimansa.
Mimansha. Okay. All of you have seen this movie, or maybe I don't know, maybe you haven't seen also. But the protagonist was suffering from a condition. You tell me the condition and you suggest a drug combination for the protagonist.
Sir, was it erectile dysfunction?
Yes.
And
Drug
reasonable drug combination would be sildenafil.
with
And um,
scorekeeper, keep a track of the time.
Time is up.
Sildenafil has significant cardiac side effects, so we don't. I mean, I will give you marks for that because definitely it is indicated in certain patient groups. But we would always want a safer drug, and if there's a next generation drug which is safer, we prescribe that. So nowadays we are prescribing tadalafil for it, not sildenafil. But still, sildenafil would be okay because tadalafil belongs to that group only, phosphodiesterase inhibitors. However, you are supposed to use something called depoxitin with it because erectile dysfunction may be associated with premature ejaculation as well. Okay, so I give her 7.5 because she identified the condition and she could mention one of the drugs in the drug combination. So she gets 7.5. Going to team D, Vaibhav.
Yes.
Relate the three pictures. Vaibhav, I can't see you. Is your video on?
Yes, sir. My video is on.
I'm afraid the time is up.
Anyone else wants to answer this?
Sir, is this a person who did the first IVF thing and later he died due to depression and pressure from the government?
Yes, and that's her creation. You tell me about all the three pictures.
Sir,
Like,
second is Subhash Mukhopadhyay, I think.
Yes,
Subhash Mukhopadhyay.
that is Durga, and
and
that movie was about his life. It was made by Tapan Sinha. So Vaibhav doesn't score in this round, but you will definitely have ample opportunities to score. Team E. It's a bit easy, I think. What were the protagonists suffering from in these two movies?
First one was progeria, Hutchison Gilford progeria, and the second one was dyslexia.
Okay, so team E gets 10 full. So we move on to team F. Name a new oral tablet being used nowadays for the chronic condition the old man was suffering from in this movie. Tell me the condition and then tell me the drug that is being used. Oral tablet. I'm not looking for laxatives. I'm not looking for anything like, fibers.
Was suffering from constipation. Probiotics like
The time is up.
We are using procalupride, which is a 5-HT4 receptor modifier, and that takes care of the constipation. And in IBS constipation type, you can also use fluoxetine. So he gets 5. But I think I had let out a hint by saying laxatives. But anyway, we'll give 5 to him. Now, before we move on to the next round, I would like each of you to introduce yourself. Very briefly, which college, what is your aspiration, like that? Team A, Anirban?
Yes, sir. Sir, I am Anirban Dev from Jipmer, final year.
Final year, okay. What do you want to be?
Sir, I am more inclined towards the like field of medicine and pediatrics, but I'm waiting for internship to get skills in other surgical
No,
fields
I'm just
also.
asking about your current status. I mean, it keeps changing. People are, even after doing their MS, may shift to something related to medicine. Anyway, Mahima, introduce yourself, please.
Yes, sir. My name is Mahima Advaita Ramakrishnan. I'm from Kasturba Medical College, Mangalore. And my interest currently it's fluctuating between neurology and OBGYN. So it's like I will keep shifting.
Good luck.
Thank you, sir.
Yeah, Mimansha.
Good evening, sir. This is Mimansa Jindal from UCMS Delhi, and I've always wanted to become an oncosurgeon, though I'm a bit unsure about it currently.
Oncosurgeon would be a very wide and general term. You should rather choose a subspecialty, because surgical oncology, with time it's kind of, I mean, it's so vast. It's more vast than general surgery. You can't be a master of everything. So even if you're interested in oncology, choose which organ you want to work on, and then subspecialize in that. Okay,
Yes, sir.
that would be a friendly suggestion. Now, Vaibhav.
Sir, my name is Vaibhav Agarwal. I am studying in Archikar Medical College, Kolkata, and I'm currently an intern.
Your wish or your desire?
Sir, I would like to pursue medicine in the future.
Somodipto.
Good evening, sir. I am Soumyadipta Satpathy, final year student from AIMS Bhubaneswar. Currently, I am interested in pediatrics.
Good. Lot of trouble, precious lives. Sriram.
So I'm Sriram from Gandhi Medical College, Hyderabad. I'm presently an intern. I would like to take up general medicine future.
Great. So we have a pan-Indian contestant group. So without wasting more time, we are moving on to.
Sir, before we move on, I would like to ask the scorekeepers to share the scoreboards once.
Definitely.
May I tell, or I will share the mark sheet?
No, you can tell. No problem.
Okay.
Down any scores.
Team A has 5 points. Team B has 5 points. Team C has 7.5 points. Team D has 0. Team E has 10 points. And Team F has 5 points.
So moving on to round 2. Team 6 gets the first chance now. We'll rotate, like, So this is actually, I mean, it's written Team A, but Team F gets the first chance. So Sriram gets to answer this. A lady aged 30 years presented with a hard thyroid swelling. During surgery, gross adhesions were encountered and a hemithyroidectomy was done to relieve pre-existent tracheal compression. On histopathological examination, it was found to be non-malignant. This is the specimen of hemithyroidectomy. I mean, how it looked like. You mentioned the possible diagnosis for the thyroid pathology, and she also has bilateral hydroureteronephrosis. So what could be the etiology?
So she possibly has Riddle's thyroiditis, which led to the fibrosis of the thyroid gland, and she also had retroperitoneal fibrosis, which led to hydroureteronephrosis.
What is that called?
Sir?
Retroperitoneal fibrosis. Do you know the name of the syndrome? Or, someone's name after which it is named?
No, sir.
I'll give you the point. He gets a 10 out of 10. It's called Ormond's disease. Okay. Team E. It's Shomodipto or Somadipta, whatever. This is the upper left arm of a patient who underwent left modified radical mastectomy 5 years back. What procedure is being done on this lady? And on the other side, you have a post-operative photograph of a procedure that has been performed between the bilateral common carotid arteries. You identify or name the procedure which could have been done. 5 for each. Time?
Up.
Time is up?
Yes, sir, the time is up.
Anyone else wants to answer? So in the first picture, we see that, lymphedema is being treated by creating subcutaneous tunnels and putting in silastic tubes, which would drain the lymphedema fluid from the wrist to the scapular lymph node groups, and then it would drain through alternate pathways. And the second procedure is a total thyroidectomy with central compartment neck dissection, the boundaries of which are the bilateral common carotids. You can see that the thyroid is not there. Had you said total thyroidectomy, I would have given you. Anyway, team D, Vaibhav. During wide local excision for an early breast cancer, some ancillary procedure was also done. Identify the tubes or wire, and why have these been placed? Vaibhav?
Yes, sir. So,
Yeah.
so these tubes or wires might have been placed to keep the tissue at the position or to prevent collection of any blood or something like that. I don't.
That would be an oncoplasty. So, these wires are, anyone else? Have you seen in your center? Or corona has, locked you inside your hostel rooms and you're not seeing anything practical. Anyway, these are brachytherapy wires which have been placed, and we are planning to do an accelerated partial breast irradiation. Okay, APBI. Team C, Mimansha, I guess.
Yes, sir.
From the series of photos, identify the procedure done as oncoplastic wide local excision for carcinoma breast. For which tumor can you not do this procedure? For which tumors means tumors located in which part of the breast can you not do this procedure? The second part is very easy. You can answer from your common sense.
So this is a perioral incision done for lumpectomy. It's a breast conservation treatment that we are doing here.
But this perioral incision with two parallel, concentric circles, and then a part of it deepithelized. This has a special name.
The time is up.
Sir, I'm forgetting the name. It's something with G.
It's not exactly G. G is when you sacrifice the nipple areolar complex. It's called Grisoti.
Yes, sir.
But this is not Grisoti. This is a simple round block technique of Benelli. And you cannot do it for centrally located tumors because you're preserving the nipple and areola. So the second part was very easy. You could have answered it from common sense. Anyway, now we go to Mahima. From the preoperative markings.
Sir, what would be the marks of last?
He didn't answer anything. So
okay.
Mancha doesn't get anything. So I think I'm not having a control on my cursor. You can see that there's a mark in the neck. There's a tumor in the neck. And there are two lines, one extending from the axilla to the neck, the other one from the areolocutaneous junction to the neck. These are preoperative markings for a particular surgery to remove a tumor that has been marked in the neck. You can see a tumor which has been marked in the neck in this first picture. And the second picture is the post-operative picture. There are two lines which have been made, one from the areolocutaneous junction and one from the axilla reaching up to that tumor. And there's a small line which is located in between the other two lines. So these signify something. You have to identify the procedure for which this kind of marking is done. And the postoperative appearance is something like this. Mahima.
Sir, is it a pectoralis major flap which goes over the neck for a lymph node dissection, neck dissection?
It's a good try, but flaps would be marked, you would mark the entire island. This is a thyroid tumor, you can see. And the thyroid is being accessed from the breast and the axilla. So this is a BABA, or an ABA, axillary breast approach for endoscopic thyroidectomy. Okay. So this is a scarless thyroidectomy. You don't have a scar in the neck, though you end up with scars in the axilla. Okay, now moving on to team A, Anirban. A gentleman aged 25 suffering from CKD5 and on hemodialysis was detected to have a condition for which he underwent a surgery. Identify the condition for which he was operated. Identify the imaging that has been done. Anirban?
Yes, sir. Is it like parathyroidectomy and tertiary parathyroid, like tertiary hyperparathyroidism, the procedure has been done?
See, would you like to modify your answer? No?
Sir, imaging is technetium scan.
Specific imaging for parathyroids?
Sestamibi scan, sir.
Okay. So for the next part, you get a 5. It is a Sestamibi. Indeed, it is a Sestamibi scan. However, the first part, I mean, why would you say tertiary? In tertiary, there's a specific, over-functioning adenoma where you remove that. It's secondary, where you have removed almost all the parathyroid glands. You have done a 3.5 parathyroidectomy. So it's secondary hyperparathyroidism. So, I mean, since you said hyperparathyroidism, you get 2.5 for that. And since you have identified the image, you get 5. So you will get 7.5. So 7.5 to Anirban. And then we move on to round 3. However, I would like the scorekeeper to just, give out the scores once.
Sir, as we are short of time, we decided that we would share the scores directly after round 4.
Okay. Well, so we go on to round 3, and again, question is to Anirban. The device is present in all operation theaters in the United Kingdom. However, they are yet to enter the OTs in India. See the entire picture and identify the procedure or drill or whatever. I mean, what is being done here? You can see a screen, you can see an area where, an arrow is pointing, where something is kept.
The time is up.
This is an intraoperative or just post-operative specimen mammography. You're doing a mammography of the tumor which you have removed, after surgery. Team B, what is the gadget? What is the team of surgeons doing here? I mean, if you identify the gadget, you can say what they're doing. So it's just one question. Mahima.
So is this the Da Vinci machine?
Bang on, right. 10 on 10.
Thank you, sir.
Round C, team C. Identify these 2 specimens of the same organ and mention indications, any 1 or 2 indications for this surgery. You identify the organ from its anatomical appearance and whatever has been written on that sheet behind the specimen. And then mention any 1 or 2 indications for this surgery.
So this is thyroid. So this is thyroidectomy. It's a post-thyroidectomy specimen, and 2 indications. It is done prophylactically in case of medullary thyroid carcinoma and as a therapeutic treatment in case of papillary thyroid carcinoma.
But alas, this is not thyroid. This is thymus, because it has 2 horns also.
Yeah, missed it. Yes, sir.
And this pericardial pad of fat that has been taken out as well. So this is a thymectomy, and its indications would be thymoma or thymic carcinoma or myasthenia gravis, whichever. So team D. A patient with T2N0M0 CA breast underwent wide local excision and sentinel node biopsy. The wide local excision was done employing a special technique to ensure tumor-free margins. The specimen has been illuminated by blue light and sometimes it is done by a special, spectrometer. After the excision, identify this technique from the appearance of the specimen under blue light.
Sir, is this centiMAP procedure where we use iron compounds?
You see, under blue light, something is looking like this. What is this color called? I'm giving you a hint because it's a bit difficult. What is this color called that you can see on the specimen?
Sir, apple green color.
Huh?
Sir, apple green color.
Or in the sketch pen set which we used to have in school, what
Fluorescence.
Yes. So this is fluorescence guided excision. Fluorescence guided excision. So should we give him some point? I'll give him 5, I think, because he could pick up the hint. Okay. So moving on to team E. Identify the specimen. Note the arrows pointing to a continuous staple line. Mention 2 other alternatives to this surgery. This question goes to Soumya Deepta. I can tell you which organ it is, or I can tell you what condition the patient underwent this surgery for. Which clue do you want?
Condition.
Huh?
The condition.
Obesity, morbid obesity.
Sleeve gastrectomy, and it can be gastric banding or Roux-en-Y gastroadenosine.
Gastric bypass. Yeah, okay. So since he answered with a hint, I give him 7.5. Going to Sriram. While planning for which surgery do you perform these kind of markings a day before surgery? Sriram, you there?
Yes, sir. This is the making of marking for the flaps, like
You name the specific flap for which this marking
lattice. That is latissimus dorsi flap, sir. The middle one.
What is the blood vessel it is based on?
No idea.
Thoracodorsal pedicle, but that's not part of the quiz. So you get a 10 out of 10. Going to round 4. Both these organs have been surgically removed from a patient at the same time. Identify the specimens and make a diagnosis. This question is to Sri Ram again.
Sir, it is like the Krukenberg tumor. She's having bilateral polycystic ovaries and she's having some gastric mass. Which
ovarian deposits, not polycystic ovaries. Polycystic ovaries is something else.
Yeah. Basically, it's a Krukenberg tumor metastasized from the gastric cancer to the ovaries, leading to.
Okay. So I'll give him 7.5 for this because he said polycystic. I will deduct 2.5. Or should we not? Should we give him a 10 out of 10? What is
Sir, it's up to your discretion.
Sir, it's your decision.
I'll give him 8. I'll give him 8. Okay. So, Soumya Deepta, identify this object.
It is used for measuring the anorectal pressure.
No. This is something you named in the last round. This is an adjustable gastric band, which is used for obesity. Vaibhav, mention the diagnosis from the endoscopic view and the contrast X-ray that has been done. Very easy. This is an upper GI endoscopic view, and you have an X-ray also, contrast X-ray demonstrating 2 tubular structures with a connection.
Tracheoesophageal fistula.
I'll give you 7.5 for that. 2.5 for 2.5. You have to be a little more specific. Which year are you?
So intern.
Intern should be able to say this.
So type H of tracheoesophageal fistula.
So he gets a 10 out of 10 for this. Very good. Question 2, Mimansha.
Yes, sir.
Injection or instillation of Coca-Cola is nowadays being used to treat this stomach condition. Identify this condition from this CT scan and mention a non-surgical alternative used as treatment modality.
So can I have some hints, please?
Hint is given in this question. Ingestion or instillation of Coca-Cola is nowadays being used to treat this stomach condition. Identify the condition which you could find in patients with trichotillomania.
So this is a buzzwar, phytobuzwar. No, it's a trichobuzwar in a patient, and a non-surgical alternative would be we can use preventive therapies like cognitive behavioral therapy for this patient.
Listen, since I gave you the hint, I will ask you to mention the syndrome. Name of the syndrome associated with trichotillomania. Rapunzel syndrome. And what was the non-surgical Rapunzel? You all have heard of the story of Rapunzel, right? Who had very
Yes,
long hair. Yeah. So, what is the non-surgical alternative for treatment?
So we can give behavioral therapy to this patient first of all.
And since she has already developed this, she can't eat.
So something we can probably give something which can lyse keratin.
Yes. Name of the substances.
Sir, keratinase. I'm not aware of the exact name.
It's Adolph's meat tenderizer or certain proteases like whatever. So I would give you, I mean, the specific is Adolph's meat tenderizer. And the first one was a trichobezoar, which is found in Rapunzel syndrome. So I'll give you overall 7 out of 10. Okay. Moving on to Mahima. What is this condition on endoscopy? What is the commonest site?
Sir, diverticulosis, and the most common site is the sigmoid colon.
Very good. 10 out of 10 to Mahima. This question is for Anirban. What is the diagnosis of this pulsatile abdominal swelling? Mention 2 criteria on the basis of which decision regarding surgery is made. This is a contrast enhanced CT scan in the arterial phase.
Sir, abdominal aortic aneurysm, and 2 criteria is Stanford and.
No, I don't want names. I want like what are the clinical.
Less more than 5.5 we'll treat, and in Marfan syndrome, if it's more than 4.5 we'll treat.
It's also about the sex of the patient, like
yes, sir.
Different size for males, different size for females. That is one criteria. Size criteria. What is the other criteria?
Sir, I'm afraid the time is up.
If there's an emergency like rupture, or if it is increasing in size over serial CT scans. So I'll give him 7.5 for this. Do we have the scores after this, or we'll have the?
Yes, sir, we have the scores after this. Abhishek, can you please share the scores?
Yeah, I will share the scores. I will share the screen and demonstrate.
Yes, I think you should share the screen now.
Sir, you may share after I complete it, okay?
Okay.
Anivar Demb has round 1 score 5, round 2 score 7.5, round 3 0, round 4 7.5. He has total score of 20. Team B, she has round 1 score of 5, round 2 of 3, round 2 of 0, round 3 of 10, round 4 of 10. Total she has 25. Mimansa Zindal, Team C, she has round 1 of 7.5, round 2 0, round 3 0, round 4 7. Total of 14.5. Team D, round 1 0, round 2 0, round 3 5, round 4 10. Total is 15. Team E, round 1 10, round 2 0, round 3 7.5, round 4 0. Total 17.5. Team F, round 1 5, round 2 10, round 3 10, round 4 8, total 33.
Okay, sir, you may continue now.
This question goes to
Anirban Dev.
we'll start from which team? What was the last round like?
Anirban.
From
Sir, Anirban Dev. It will go to team A.
team A only, na?
Yes, sir.
Identify the specimen. What treatment has the patient been receiving after this surgery?
Sir, it's horseshoe kidney. And what treatment? Sir, what treatment as in like the indication?
After this operation has been done, what treatment must he be, must he be on?
Sir, renal transplant must have been done because both the kidneys have been removed. So immunosuppression must have been given.
No, like, the answer is renal replacement therapy. It could be either hemodialysis or a renal transplant, because the crux of this is, since you have removed both kidneys, which are, fused
Yes,
as
sir.
one, that won't be compatible with life unless you have done some kind of renal replacement therapy, either in the form of dialysis, or it could be a peritoneal or a hemodialysis, or renal transplant. Okay, moving on to Mahima. This is the leg of a patient. Identify this procedure. Mention 2 other options of treatment for this condition, surgical or non-surgical.
Sir, radio frequency ablation
Of
varicose veins. And the 2 other options is, one is the conventional Trendelenburg operation, which is the stripping. And you can also, instead of radio frequency, you can also instill any chemicals. So it can be chemical ablation as well.
Which year are you?
So I'm in final year, sir.
Okay. This is not radio frequency ablation. This is something called subendoscopic perforator, subfascial endoscopic perforator surgery. So we are going below the fascia, and we have this laparoscopic ports, which we are using to introduce the camera. And then we are ligating the perforators or cutting them. So this is basically surgery done for perforators. Okay.
Sir?
Yes.
Sir, what marks would Anirban Dev get? He answered one question, I guess.
No, he answered both. So he will get 10.
Oh.
So Mahima, this is SEPS, and the other techniques are, okay, chemical ablation, I'll give it to you. And obviously, since this is a surgery for the perforators, you won't be doing Trendelenburg for it. You would do a stab, phlebectomies, multiple phlebectomies, or perforator ligation, or you would do Linton's procedure, or you would do a foam sclerotherapy like that. So I'll give you, I know overall you could identify this is something for the varicose veins, and you could say chemical ablation. So I'll give you a maybe 2.5 out of 10. Identify the tool. Mention 1 use of this technique in any benign condition. Nimansha.
Yes, sir. So this is a radio frequency ablator, and it's common. It can be used in cardiac conditions also to ablate any ectopic foci.
Very
Or
good. I'll give it to you. How did you identify this is a radio frequency tool?
Sir, I could see a probe in front of it.
There are nine branches. That is
Yes,
very indicative of a radio frequency ablator. So 10 out of 10 to Mimansha. Moving to Vaibhav. Give a diagnosis of this neck pathology from the radiological picture and the anatomical window dissection. And what is the sign you see here on angiography? Vaibhav?
Yes, sir.
This is the neck. CT, and this is a angiography that has been done, DSA, and you can see the operative or the anatomical window in the neck having the tumor in the same patient.
So glomus tumor.
Of, and what is the sign you see here on angiography?
Sir, I'm afraid the time is up.
See, you were close. I can't give it to you because glomus tumor would be in the jugular vein, the jugular bulb. However, this is a carotid body tumor. And the sign you see here is called the liar's sign. Okay. So, I think I can't give you anything for this. Soumya Dipta, identify the device, a part of which is shown here. And you have to name the parts marked as 1 and 2. A part has been marked 1 and some structure has been, some tissue has been marked as 2. What are the technical terms for 1 and 2? We have 1.5, 1.5 marks for the parts you name, and for the device you get 7. Any idea?
No, sir.
So the time is up too.
Circular stapler for end-to-end anastomosis of the gut. The part which is marked 1 is called an anvil, and the tissue that has come out is called a donut. Okay. Now, on this CT scan of the neck, identify the structures which are marked as 1, 2, and 3. Name 2 clinical signs which you expect to be positive in a case having such CT findings. This question is to Sriram. Sriram?
Sir,
1 and 3 are the same. Hint.
is tooth trachea?
I will not answer. You will answer all the parts together.
The time is up, so you should answer finally.
Okay, 2 is trachea, 1 and 3 are the common carotids. And the clinical signs would be Cocker's test would be positive, or patient will have Pemberton sign. And not Pemberton sign, Cocker's test will be positive, and because of involvement of the carotids, the patient will have Berry's sign positive. So I'll give him, should we give him 2 because he said that, the structure mark 2 is trachea. So we'll give him 2 out of 10 for this. Now going to round 6, we reverse the order. We start with Sriram. Name the investigation. What is the usual length of the structure marked with arrow? Which 2 nerves mark its upper and lower boundaries?
Sir, which part is this?
I won't tell. It's a telltale X-ray where you have certain.
Okay, it is the parotid duct. The usual length is 15 centimeters and investigation is ductography. The 2 nerves.
The time is up, so you should answer finally.
Yes, so this is a parotid duct, true. This is a xylogram, or a ductogram is fine. But xylogram is the term. So I'll give you half on that. And length is 5 centimeter, not 15. The nerves which mark its upper and lower boundaries are the upper and the lower deep buccal. So, I mean, we can give him, I think, 4 out of 10. Or 3. Yeah, 4 out of 10 is fine. Soumya Dipta, what is the investigation that is going to be done subsequently on this patient? What makes you say so? This is a fluoroscopic view of a tube that has been inserted into a patient's abdomen. You identify this tube, then you will know what investigation is being planned eventually on this patient.
Is this flattish tube?
I won't tell you. Why would you put in a flatus tube as an antecedent to do some other investigation? Would you?
The time is up actually.
This is a nasojejunal tube. The tube, Bilbao daughter tube, which is put in fluoroscopically, and then you put in some contrast and you do a small bowel enema. Okay, for diagnosing small bowel pathologies like inflammatory bowel disease or maybe tropical sprue, other things, other small bowel conditions, or even surgical conditions. So what is the most probable etiology of this hydronephrosis and segmental hydroureter in this patient? This is to Vaibhav. This is an IVP where you see a part of the ureter dilated and the pelvic calyceal system dilated. And you can see that the lower end of the ureter is shifted towards the midline. Now that's hint enough. Diagnosis.
Is this retrocaval ureter?
What is the treatment of choice?
Shall we do excision and then reanastomosis?
What is it called? Anyway, I'll give it to you. It's ureterostomy or transureterostomy. And retrocaval ureter was the, it's a redundant term. The actual term is pre-ureteric vena cava. The vena cava is abnormal, not the ureter, because it's due to the faulty joining of the cardinal veins. So, and it forms in front of the ureter, and so it's not a retrocaval ureter, it's the pre-ureteric vena cava that is causing the problem. Okay, so he gets a 10 out of 10 for this. And next we move on to Mimansha.
Yes, sir.
Name the surgery done. You see the lower end of the specimen very carefully. Something is coming out, something is also attached to the upper part of the specimen. So you identify the surgery done and mention the possible indication for such a surgery. Think of the different types of carcinoma that could occur in the kidney, and your answer would be one of them. I won't tell you which one and why. You have to identify from the specimen.
So this is a urothelial carcinoma of the ureter, because I can see a DJ stent also which is coming downwards, and one possible indication of the procedure. I mean, as in,
yeah. I think you have already said urothelial carcinoma.
Yes, sir.
But not of the ureter. It could be of the renal pelvis also, because ureter, if it affects the ureter, we do a segmental excision of the ureter.
Yes, sir.
So I would give you some points for that. What is the surgery done? What is this surgery called?
So this is unilateral nephroureterectomy, basically.
With a cuff of the bladder. With a cuff of the bladder. Okay, so I'll give you a 7 or 6. I'll give her a 6 because there was a fault with the organ. She said ureter, and a cuff of bladder she missed. So we deduct 4 marks and we'll give her 6. Next. Mahima. Identify the investigation that has been done, and from the investigation and from the picture of the specimen, identify the condition for which the patient was operated.
Sir, ERCP and gallbladder cancer. Carcinoma of gallbladder.
ERCP is fine, but this is not gallbladder carcinoma. You can see a cystic structure in the CBD. So
Yes, sir.
the choledochal cyst for which the patient has been operated. So I give you a 5 out of 10 for identify the investigation. Team A, Anirban. What is your diagnosis in the sense something has been tried, some investigation has been tried, and there has been a complication arising out of that investigation. So what is that complication that has occurred? And how can you prevent such an occurrence? I'll give you some points if you can say
Sir,
what.
investigation is capsule endoscopy, and it is obstructed.
Good.
So,
How can you prevent such an occurrence?
sir, by selecting a proper size and making sure that it is not getting obstructed at the ileocecal valve, like maybe we need to do a bowel preparation for that.
No, I give you 7 because you can prevent such an occurrence by doing a pre-procedure by using a dummy capsule which gets dissolved in case it gets stuck. Suppose you're doing small, that capsule gets stuck, so you know, okay, there is some stricture somewhere in the bowel, and hence you leave it there, and since it is an absorbable material, it gets absorbed, and then you don't pass the actual capsule endoscope in. Okay, so I give him a 7 out of 10 for this. So that brings us to the end of the 6th round. Then we start the optional rounds, and we will go from Anirban to Sriram.
Sir, before starting round 7, we'd like to know the scores once. So I'd
Yeah.
like Abhishek to.
Let us finish the combined rounds up to round 10, and then we will give the score, and then we'll move on to round 11, 12, and 13.
Okay, sir. Sure, sir. Okay.
So round 7, Anirban does not have a question in round 7 because he chose to answer in round 8. So we move to Mahima, who had chosen round 7. So team A's question is wasted. Team B gets this question because she had chosen round 7. Mention the complete procedure being done here. See the markings, see the instrument that has been put in. What can you do with that kind of a narrow instrument with a lumen?
So aspiration
Of?
I'm not sure, so maybe ascitic fluid.
The time is up.
Suction lipectomy or liposuction that is being done. And these markings have been done because after liposuction, what happens is there's a lot of redundant skin, so you need to do an abdominoplasty. Okay. So moving on to Mimansha chose to opt for round, she opted for round 8, Vaibhav 9, Soumya Dipta, so this question is wasted, this question is wasted. Shoma Dipta had...
To interrupt you, sir, did she get any points in the last question?
Who?
So just now that we had team B.
No, she didn't answer anything.
Okay, sure, sir.
So team C, you chose to not answer this question. Team D, you chose to not answer this question. So feel bad if you knew the answer to this. Then team E, Soumya Dipta, you chose to answer this question from round 7. Name the procedure in which this assembly of instruments is used. This is a gun. This kind of a gun could be used in which procedure? Soumya Dipta? These are general knowledge kind of procedures. Interesting procedures, latest. People are talking about these. You can see, 2-3 of your neighbors who have undergone this procedure. It's so common. Soumya Dipta, are you there?
Yes, sir.
You know this?
The time is up actually.
It's a stapled Longo's procedure for hemorrhoids. Hemorrhoidopexy, stapled hemorrhoidopexy. Everybody, nowadays you hear people having piles, hemorrhoids, they will say doctor has stapled it. So this is what you use it for. I mean, this is the thing with which you do it. Okay. So Sriram also skipped this round. So he missed this question. I think he is now feeling sorry. So moving on to round 8. Anirban has to answer this question because he chose round 8. Identify the object from the 3 images.
Sir, it's an pacemaker, like implantable cardioverter defibrillator.
The instrument also, which is there outside.
Sir, outside it will it will tell you the time when your heart rate
Does
is
it have
like.
all the parts of a pacemaker?
Sir, there is a external part, and which is again through the subcutaneous.
You see all the 3 pictures and then answer. It's something which looks like a pacemaker but is not. It's difficult, so I'm giving you a hint.
The time is up.
It's a chemo port. You have heard of chemo ports?
Yes, sir. Yes, sir.
It was close, but anyway. So next question. Mahima, you chose not to answer this question. It was a bit difficult, so I think you must be happy. Mimansha, you have to answer
Yes,
this.
sir.
Identify the procedure being done during upper GI endoscopy. What are these objects made of? Endoscopy is being done. Simultaneously, something is being deployed over there.
Yes, sir. So this is used for echolalia cardia, and so these are metallic stunts which are being kept in the esophagus to prevent it from collapsing. And material, I'm not sure if it's
Nitinol coated titanium stents.
yes, sir.
Something like that. It's variable, but these are self-expandable metallic stents. That's right. But you won't do it for echolalia, and it was not asked also. Indication was not asked also. You would do it for malignant strictures of the esophagus or the duodenum. You know?
Yes, sir. To keep it patent.
Yeah. So she gets 9 out of 10 for this. No, material she didn't answer. So she will get 7. 7 out of 10. This question would have been for Vaibhav, but he chose some other round. This would be for Shomodipto, but he chose some other round. This would be for Sriram, but he has chosen some other round. So round 9, I think Anirban skipped this question. Mahima skipped this question. Mimansha skipped this question. No. Mimansha's question is this one.
Sir, I just answered in round 8.
So team D is going to answer in round 9.
Okay, so this is for Vaibhav.
Yeah.
This photo shows the tumor bed after removal of a retroduodenal sarcoma. Duodenum has been marked for you. It's written duodenum over there if you can see. Identify the structures marked as 1, 2, 3, 4, 5, 6. You identify any 4 of the structures. This is an anatomical question. This is the retroperitoneum. You have to identify structures in the retroperitoneum. That was one. 1, 2, 3.
Sir, I cannot hear you properly. Hello? Hello?
Hello? Can you
Sir,
hear me now?
Sir,
No,
actually
sir, I
your
cannot
voice was cracking. Can you repeat once?
I'll just change my internet connection.
We can hear you, sir.
Wait, one
now.
second. You can hear me now?
Yes, sir.
Can you hear me now?
Yes, sir.
Uh,
Hello.
This patient underwent the removal of a tumor from the retroduodenal area. Duodenum has been marked for you. You have to identify the structures which are marked 1, 2, 3, 4, 5, and 6. You have to identify any 4 of those structures.
Sir, the image is not clear.
Hello, sir. Can you hear me, sir? There might be some issues with your internet.
Yeah, I'm connecting with another internet. Wait.
Yes, sure, sir.
I guess now the image is clear.
Yes.
Is clear? You can see the image now?
Yes, sir.
Okay. I'll not enter the full screen.
Sir, is one the stomach bed?
Then 2, 3, 4, 5.
Sir,
2 is here. 2 is
sir, is 2 is the ureter?
okay. 2 is ureter indeed.
And
3 is a bluish.
sir, inferior mesenteric vein. Sorry, IVC.
Yes. 2, 3. So you got 2 correct. 4, 5, 6. 4, 5, 6. 6.
Sir, is for the renal, some renal vein or
Yes.
renal artery.
Okay. 4 and 5 are those.
Yes, sir. 6 is.
We have got 2, 3, 4, and 5 correct. 6 is kidney, 1 is pancreas, but you are asked to answer any 4 and you have answered that correctly. So we move on to
Sir, give marks here, right? 10.
this question has been skipped by Shomodipta and this question has been skipped by Sriram. And in round 10, this question has been skipped by Vaibhav. This question has been skipped by Mahima. This question has been skipped by Mimansha. This question has been skipped by Vaibhav. This question has been skipped by Somadipta. And this question has to be answered by Sriram. Name the investigation. Give the diagnosis. Sriram? Sriram, are you there? Is he there? Sriram?
Yes, sir, he is.
Please unmute yourself, Mr. Sri.
What is this investigation?
Please unmute yourself.
Sorry, sir, I didn't unmute myself.
What is this investigation?
Sir, it is.
Actually, the time is up, so you have to give an answer or leave.
No, but he said that he had forgotten to unmute himself. So did he have the answer or not?
They instilled a dye into the bladder and they're visualizing the bladder.
So this is a micturating cystourethrogram because you can see dye both in the urethra and in the ureter. That is possible only when you are doing a micturating cystourethrogram.
Yes, and the diagnosis is hydronephrosis. Like there is
because of an ureterocele. Ureterocele is also there. So I can't give anything to Sriram for this. So we'll go to the scores once before we go on to the next, compulsory 3 more rounds.
Yes, sir. So the scores are: Team A has 37 points, Team B has 32.5 points, Team C has 37.5 points, Team D has 35 points, Team E has 17.5 points, Team F has 39 points.
So moving on to round 11. Moving on to round 11, we start with Dhritiman. What's the link?
Sir, both suffered from ADHD associated disorder.
What? What
Uh,
associated disorder? I can't hear you.
Sir, attention deficit hyperactivity disorder.
No, both suffered from Marfan's syndrome. Can you hear me?
Yes, sir. But this is Michael
Okay,
Phelps.
moving on to the next. I mean, that could be a rumor also. Both of them suffering from Marfan's.
Hey, Chappala next.
That's the most plausible answer. Wait. Team B, what's the link between these two pictures?
So, Cushing syndrome.
No, you have to link the two pictures.
But Billy Board and what? He had Alzheimer's.
Sriram, don't talk.
Oh shit.
Mahima, you have to link the two pictures.
Yes, sir.
Who's that man?
The time is up actually.
That's JF Kennedy.
I'm not sure.
Who suffers from Addison's disease, and this is a patient of Cushing's disease. So the link is adrenal. Okay?
Okay, sir. Yes, sir.
Is adrenal. What is the cause of this self-mutilating disorder? Mimansha.
Yes, sir. So this is Lesch-Nyhan syndrome, and because of which the person has a self-mutilating behavior.
Very good. Vaibhav, what was he suffering from? Who is he and what was he suffering from?
Sir, Stephen Hawking suffering from amyotrophic lateral sclerosis.
Very good. Full mark to him. Soumyadipta, identify this condition that the baby is suffering from.
Erb's palsy.
Full name of the palsy? I give it to you anyway. The abduction.
Due to birth injury. Erb's palsy due to C5, C6 nerve root damage.
Okay. So 10 out of 10. Sriram, name the sign. You have to name the sign.
Sir, Medusa head sign.
It's Caput Medici, that's right. But what is the sign called? It has a specific name after a scientist. I'll give you 5 if you just say Caput Medici. It's also called Curvailier's sign, Curvailier's sign, or Carvalier's sign, or whatever way you pronounce it. Okay, now starting from Sriram, we move on to round 12.
Sure.
Starting from Sriram and going backwards. What condition does the lady protagonist suffer from in this movie? "50 First Dates," Adam Sandler. What condition does the lady suffer from?
Sir, amnesia.
Very good, very good. Antigrade amnesia, but I will give it to you. Going to Soumyadipta, whose life is this movie based on? Even if you can't answer that, which medical condition was he suffering from? Beautiful mind.
John Nash.
Yes. Condition he was suffering from? Say whatever you know. Feel free to answer.
Parkinson.
It's paranoid schizophrenia that he was suffering from. Okay. So this question goes to Vaibhav. Does it go to Vaibhav?
It is for the last question, sir. Did we award any marks to the last?
5.
5. Okay, sir.
Which drug causes this condition? Name one drug causing this condition. Vaibhav.
Sir, thalidomide fucomed.
The protagonist and his best friend were both doctors in this movie. What were their specialities?
But I haven't watched this movie, but maybe I can just have a guess.
Yeah.
So randomly, maybe the guy was a cardiologist and the girl was maybe a gynecologist. I don't know. I haven't seen the movie.
No, the girl was not the best friend. The girl was the girlfriend. His best friend is not in the picture.
Okay.
The one who is not in the picture was a breast surgeon and he was a dentist.
Oh.
So,
7 marks for this question.
moving to Mahima.
So,
No, she doesn't get anything. No marks for this question. Mahima, what does one of the leading ladies suffer from in this movie? What could you have treated it with had it been CD20 plus? The second question is let out. It's a hint for the first part.
Sorry.
I'm afraid the time is up.
Sir, I'm not sure, but maybe Hodgkin's lymphoma.
And what could you have treated it with had it been CD20 plus?
Bortezumab or bortezumab.
If it's CD20 plus, you treat with rituximab, and whatever information I found from that and whatever I had seen and remembered, it was lymphoma. They didn't specify whether it was Hodgkin's or non-Hodgkin's. So, I mean, had it been lymphoma, I would have. So, I think I'll give you 5 for the first part you answered, and second part was wrong, obviously. What could be the treatment options for this gentleman for the condition which claimed his life? So, for that, you have to know which gentleman this is. Anirban.
Pancreatic cancer and Whipple's procedure, if chemotherapy was required, it would be gemcitabine based chemotherapy.
10 out of 10. And if it was inoperable, like the way he was diagnosed?
Sir, a palliation or triple triple bypass.
Very good. Full mark to him. So this was round 12.
so can you see the
Was
score?
this round?
It is the last one. So I would like Anjanashu to show the scores, please.
I am sharing the
Yes.
screen.
You read out the scores.
Okay, sir. So the scores are Team A 47, Team B 37.5, Team C 37.5, Team D 55, Team E 32.5, Team F 54.
Okay. So if there's a tiebreaker, there's need of a tiebreaker for any of the. How many prizes are you giving? First, second, third?
Yes, sir. First, second, and third.
First, second, third. So there might be need of a tiebreaker. So if we need a tiebreaker now, we will go back to the questions which you had left in rounds 7 to 10. And you have to now choose the order in which you want your tiebreaker questions to be told to you. You get plus 10 if you answer the first option. You get plus 5 if you answer the second question. Or we make it 15, 10 and 5. You get plus 15 for the first option, plus 10 for the second option, and plus 5 for the third option. So, Anirban, you say your preference in order of, you have answered 8, you are left with 7, 9 and 10. So, you tell us the preference of your tiebreak questions. You want 7, 9, 10 in which order?
I'll take 9, 10 and 7.
Mahima?
Sir, 10, 8 and 9.
Nimansha?
Sir, 10, 7 and 9.
Vaibhav?
So 10, 8, 7.
8, 7. Shomadipta?
10, 8, and 9.
Sriram?
Sir, 8, 7, and 9.
That brings us to the last round. Okay. So it starts from whom? Sriram? Or does it start from Anirban?
Sir, me, I think.
Okay. So Anirban, identify the syndrome. Presence of RCC, paragangliomas, and brain
Sir,
hemangioblastomas.
von Hippel-Lindau syndrome.
Very good. 10 out of 10. Mahima. Paraganglioma, GIST, pulmonary chondroma. Identify the syndrome.
So Carney's triad, Carney's syndrome.
Very good. Very good. Mimansha. Primary pigmentary nodular adrenal disease and cardiac myxoma, along with several other hematomatous.
So this
Identify the syndrome
is
or the complex. Can you answer?
so this is Carney's complex.
Very good.
Hello.
Very good. Very good. We
Hello.
heard
So
you.
this is Carney's complex.
Yes, we give it to you. We have heard. We are giving you 10 out of 10.
Okay, sir.
Question to Vaibhav. Pituitary tumor, pancreatic tumor, parathyroid hyperplasia. Identify the syndrome, 5 marks, and mention the thyroid cancer, type of thyroid cancer encountered in the syndrome.
Sir, MEN syndrome.
Specific
So MEN 1 syndrome.
type of thyroid cancer you encounter.
So medullary carcinoma.
MEN 1 is correct, but in MEN 1 you don't have medullary, you have non-medullary thyroid cancers in MEN 1. And in MEN 2A, 2B,
Thank
and
you.
medullary thyroid carcinoma syndromes, or MEN 3, MEN 4, you find medullary thyroid cancer. Okay, so we will give you 5. Team E, perioral pigmentation, hematomatous GI polyps. Identify the syndrome. Easy syndrome, so you have to mention the mutation also.
Peutz-Jeghers syndrome.
Yes. Mutation in
STK11.
STK. Okay. 10. Sriram. Pigmalion syndrome, Prader-Willi syndrome. What is common to both these conditions?
Obesity, sir. Pickwickian syndrome is obesity.
Okay. And what kind of mutation occurs in both of these?
Sir?
We'll give him a 10 out of 10 because that was the question. So that brings us to the end of the quiz unless we need a tie break for any of the positions. Scorekeeper, you tell us whether there is a tie for any of the positions. Later, you give us the final scores, but now you tell me if there's the need for a tie break or not. Do we have a definite first, second, and third, or do we have a tie for any of the positions?
We have a definite first, second, third.
Okay. So what we will do is the questions which we hadn't included, I'll just show them the pictures and tell you the answers so that you know your knowledge is enhanced. So round 7, this question was not answered by anyone. This is a Bishop-Cook procedure done for Meconium ileus in neonates. This was there. This is a uroflowmetry curve showing urethral stricture. And the normal shape of the curve is a bell-shaped curve. This is, you can see the dilated pancreatic duct on CT scan, and you can see mucin being secreted from the ampulla into the duodenum. So this is an IPMN, intraductal papillary mucinous neoplasm of pancreas, and the triad is called Oashi's triad. This you have answered. A lady presents with papillary thyroid cancer and IDC of breast. It could be follicular thyroid cancer also. So the syndrome which is more common, most common in such a setting is Cowden's syndrome. This you have answered. This is a CUSA, a Cavitron ultrasonic aspirator, which is used for liver surgery. This is a lay open urethroplasty. It is also called Johansson's urethroplasty, done for long segment urethral stricture of the penile urethra. This is a cyst which is in association with an unerupted tooth. So this is a dentigerous cyst, and the investigation is an orthopantomogram. This in all lights kind of picture. This is a photodynamic therapy that is being done, and some malignancies in which it is done is cholangiocarcinoma and esophageal carcinoma, or Barrett's esophagus also. So this question was not answered by any of you. You can see a cystic structure in the upper pole of the kidney. So, and you can see the hydatid membrane. So this is a hydatid cyst of the kidney which I had operated. And the structure that is saved by and pointed by the arrow is the adrenal gland, which was spared while removing the kidney. This is a vacuum assisted closure being done on a patient with wound dehiscence in the ward. This is a hidradenitis suppurativa for which the lady underwent surgery, a flap cover after excision. This you have answered. This, most of the malignancies will have a border classification, grade 1, grade 2, grade 3, like that. But only one malignancy in the body has so many grades, grade 2, 3, 4, 5, and then you combine the two to make a complex grading system. It's prostatic cancer, which has Gleason's scoring, and that is how it is. So this cancer was this cancer would be prostate cancer with the Gleason's scoring system, and commonest histopathological grading system is a broader classification, border. And this question wasn't answered by anyone. This first one is a penile implant, and for penile prosthesis for lengthening the penis. And the second part is a Cunningham penile clamp, which was used in the past for patients suffering from incontinence. And this patient, you can see that the patient had undergone a surgery in the neck, a left-sided radical neck dissection, and following which he developed this condition on X-ray, wherein you can see that the left hemidiaphragm is elevated. So most probably it is paralyzed. And this could occur because of the injury to the left phrenic nerve. How would you confirm that? You would confirm it with a CO2 sniff test or a live fluoroscopic evidence of absence of movement of the left hemidiaphragm. These are 4 ballooned structures. Number 1 is a balloon trocar, which is used for dissection in hernia, inguinal hernia. Second one is a double balloon enteroscope for small bowel double balloon enteroscopy. Number 3 is Fogarty's, actually the picture has got a bit hazy here. I can't see properly. 3 is a Sengsteken Blackmore tube, which you would put for upper GI bleed. 1 balloon in the stomach and 1 balloon in the esophagus. And 4 I can't see, but probably something is, there's some trouble with my screen. 4 is, I think, a Fogarty's catheter, okay, which you use for removing embolus or clots from blood vessels. Now this also nobody got. This is a direct choledocoscopy or cholangioscopy, and you are removing a stone by a Dormia basket by ERCP and choledocoscopy. So this is a CT scan of showing a tumor arising, an exophytic tumor arising from the stomach, and there's no plane between the stomach and liver. So and it is CD 117 positive. Anyone wants to answer this? This is quite easy.
Gist.
And there are metastases in the liver, so propose suitable treatment.
Imatinib.
Very good. This is also an easy question. Anyone wants to attempt? A patient presented with hypertension, palpitation, and a history of syncope. Mention the diagnosis from the image and the operative specimen. Name the investigations done to come to a diagnosis.
Pheochromocytoma.
Chromocytoma.
The pheochromocytoma. Right. Left-sided pheochromocytoma. And this was there. So we have covered all the questions. Now I would ask the scorekeeper to give out the scores, please.
Actually, the score will be given at the valedictory ceremony at the end of our SAMSACON tomorrow.
Share the scores screen. Anjan Ashru. Or Ayush. Can you share the screen?
Yeah.
I'll stop sharing.
Yes, sir.
Okay, so we have the final scores here. The winner for the quiz is Mr. P. Sriram with 64 points. The first runner-up is Mr. Vaibhav Agarwal with 60 points. And the second runner-up is Mr. Anirban Dev with 57 points. I thank all the winners and also the finalists who came through the prelims and have done so well with
I
the
just recap from which institution are they? Sriram is from?
So I'm from Gandhi Medical College, Hyderabad.
Okay, very good. Congratulations. Do well
Thank
in
you.
life. I don't know whether we'll meet ever again in life or not, but good. I mean, your knowledge is quite good. Then we have,
one.
he's from Arjikar Medical College, he said, right?
Yes, sir. Yes.
Congratulations, Vaibhav. I know there's a very good teaching atmosphere in your college with Dr. Ramanuj and all encouraging you for quiz and all. So keep on the good
So
work.
much. Thank you so much.
And second runner-up,
Anirban Dev.
Anirban. He's from Jipmer.
Yes, sir.
Anirban, you are from Jipmer, but originally are you from Calcutta?
Yes, sir. Yes, sir.
Okay. So you are in which year?
Sir, final year, sir.
Okay, congratulations to all of you. Those who haven't come in the top 3, it was indeed a great feat by all of you to qualify among the top 6 out of 40 candidates, and none of you have scored badly. All of you have scored more than, I mean, you have scored quite well actually. Yeah, I mean, the same quiz we had with other groups, there would be hardly anyone scoring as much. So congratulations to all the 6 of you. Don't lose heart. There's always another stage to do well, another platform to do well. So those who couldn't come in the top 3, be happy that you came in the top 6. Congratulations to all of you. It was indeed a great pleasure conducting the quiz. Very good response from all of you. So thanks. Should I do the meeting now?
So thank you so much, sir, for spending some valuable time of yours for the quiz. I thank on behalf of the.
I hope all of you enjoyed it. You said, to mix questions from surgery and medicine, so I made the surgical rounds optional so that we could cover more questions from medicine as well. So I hope it was entertaining as well as knowledge, helped in enhancing your knowledge
Yes,
as
sir.
well.
It was a great quiz, sir. Thank you so much, sir. On behalf of the whole of the SAMSACON organizing committee, I'd like to thank you and thank you to all the participants for joining us. And also, we'd like to thank Maro, who are our gift sponsors for the Clinical Mediquiz. And the prizes will be revealed tomorrow at 7 p.m. in the valedictory session. Thank you so much for joining us.
Thank you.
Yes, sir.
I would like for a minute, we would like to take a screenshot for the sake. I would like everyone to open their cameras so that I take a quick screenshot of us. Okay, say cheese. Thank you, everyone. Have a nice day.
Thank you.
Thank you so much.